How does endoscopy treat active bleeding ulcers? Imagine a tiny camera exploring your stomach to find the exact spot where bleeding is happening. That's what endoscopy does. It's a minimally invasive procedure that helps doctors see inside your stomach and duodenum, which is the first part of your small intestine. When an ulcer starts bleeding, quick action is essential to prevent serious complications. During an endoscopy, the doctor can directly visualize the ulcer and apply different techniques to stop the bleeding right then and there. One common method is injection therapy. The doctor injects medicines like epinephrine around or into the bleeding site. This causes blood vessels to constrict, which reduces blood flow and helps slow or stop the bleeding. It's like squeezing a hose to control the flow of water. Sometimes, the doctor uses thermal coagulation, which involves applying heat through special devices. This heat seals the blood vessels by coagulating proteins, effectively sealing the bleeding vessel. Another effective technique is mechanical therapy. The doctor places tiny clips called hemoclips or over-the-scope clips directly onto the bleeding vessel or ulcer base. These clips act like tiny clamps, physically pinching the vessel shut. Over-the-scope clips are larger and more secure, especially for bigger or stubborn ulcers, and they tend to stay in place longer, reducing the chance of rebleeding. In some cases, advanced methods like endoscopic suturing are used. This involves stitching the edges of a large or difficult ulcer together, which helps protect the ulcer from stomach acid and lowers the chance of bleeding starting again. During the procedure, the doctor can also take small tissue samples called biopsies. These help test for Helicobacter pylori, a bacteria that often causes ulcers, so appropriate treatment can be given afterward. Endoscopy is considered the standard treatment for bleeding ulcers because it quickly controls bleeding, often avoiding the need for surgery. It is usually done within 24 hours of symptoms appearing, which helps prevent further blood loss and complications. Patients are typically sedated during the procedure and can often go home the same day after recovery. Along with endoscopy, doctors often prescribe medications like proton pump inhibitors to reduce stomach acid and antibiotics if Helicobacter pylori is found. This combination helps the ulcer heal and prevents future bleeding episodes. In summary, endoscopy treats active bleeding ulcers by allowing doctors to see the exact spot of bleeding and then use injection, heat, clips, or stitches to stop it. This approach is vital in managing peptic ulcer disease, reducing the risk of serious complications, and improving patient outcomes. Always remember, if you experience symptoms of a bleeding ulcer, seek medical attention promptly and follow your healthcare provider's advice for the best care.